People in LGBT+ communities are often isolated from their families, and they may have lost friends in coming out. Many move to an area because they think it's going to be a happier place to live. So when you say to them, stay home, don't go to LGBT+ spaces, to your community groups, they're finding themselves very isolated and very lonely and depressed. Lloyd moved here seeking to be part of a community. And then all of a sudden he was shut off completely, which has taken a big toll on his mental health. In Brazil, the financial crisis is making many people like Laura feel unstable mentally, as she's worried about getting fired, and maybe not even having enough to eat at some point. She says being a black woman, she faces race and gender issues when seeking work, while being lesbian doesn't affect her as much because she keeps her personal and professional relationships separate. A lot of Prince's health procedures are on hold. If COVID hadn't happened, they would have had top surgery this summer. It's obviously been pushed back, but they haven't been told anything and they're heartbroken. After coming out at the age of 22, Prince had a personal goal that a lot of their medical transition would have been done by the time they were 30. But that's now become a very difficult hurdle. Mauro has always limited his circle of friends due to being LGBT+, as he came out when he was nearly 30. He says that in Brazil there are things happening that he's terrified of, discourses of hatred and violence, and that everyone is feeling particularly fragile during the pandemic. Mauro has been especially impacted by the reduced social network due to the stigma of being LGBT+. For many LGBT+ Muslims, life can be isolating because being gay often isn't accepted in their families and communities. Omar works for an organisation that supports them, and with COVID, they're now creating community online, such as through a Pride event with countries like Saudi Arabia and Egypt. Omar says there were people saying, "Wait a minute, I'm in Saudi Arabia, it's 3 a.m, and I'm actually at a Pride." And those involved in running the events and being able to help others say that it has kept them going during COVID. The University of Manchester Studies' key recommendations are to involve LGBT+ people in response and policy making, prioritise access to disrupted LGBT+ services, allocate resources to support work already being done, develop international standards to improve responses, provide education and training on LGBT+ issues, and focus on risk reduction.